Hello, everyone. This is Dr. Carrie Bedient with the Fertility Center of Las Vegas with another episode of Fertility Docs Uncensored. I am joined by my two absolutely adorable partners, Dr. Abby Eblen from Nashville Fertility Center.
Thanks, Carrie. Hi.
And Dr. Susan Hudson from Texas Fertility Center.
Hello.
And we are joined today by Amanda Lesesne from Progyny, and she has a very extensive fertility history that, especially hearing from so many of our listeners who've had questions of, I have done this and I have done this and I have done this, and now what do I do? Amanda's story, I think, will be very helpful for many people, particularly in the not giving up hope variety. But before we get to that part of it, Amanda, we were talking to you ahead of time and found out that there is a major influence in your household's life, from the beginning until now, and that plays as much of a role as all of the fertility stuff has over the years. So thank you so much for joining us today.
That's all right. Thank you. I appreciate you guys having me. I'm certainly thrilled to have this conversation. I know fertility coverage is really important to a lot of people as they navigate this journey. So I look forward to sharing more about Progyny, and then also sharing kind of how my story interlaces with that. But yes, my fun fact about myself is that I actually earned a full scholarship to play soccer in college at College of Charleston in Charleston, South Carolina. And I met my husband there, who also played soccer, and soccer plays a huge part of our lives, where he still professionally coaches today. So it's a huge component of our lives, and we certainly love it. And a lot of people don't know that about me.
That's neat.
Yeah.
So what is like the biggest soccer game you've ever been to?
Oh, that's a good one. The biggest one I've probably been to is we went to an AC Milan Juventus game in Milan, which was really amazing. Yeah, and we've been to England a couple times games, and been to I can't even name the number of soccer games that I've been to. So, but I definitely love it, and it helps that I played, because I cannot imagine being married to a coach if you did not play the sport. That would be so hard.
So now, do you travel much with the team, or with two little ones at home? Probably not so much.
Yeah, I don't anymore. I used to go along to a lot of the games, but now it's a little bit more complex to do that.
Yeah. Well, I'm a Nashville FC season ticket holder, but I wish I knew a little bit more about soccer than I do. I need to pick up a Soccer for Dummies book, I think. My son played soccer in high school, but it was just, I don't know a lot of the ins and outs of it. So that's really exciting.
Yeah, it's just fun. It's a fun environment to be a part of. And in communities like Nashville, where it's just kind of getting off the ground, I think people are really supporting it. So it's really neat.
Have you watched the Wrexham series with Ryan Reynolds and all of that?
Not yet. Is it good?
I have heard wonderful things about. I've only watched like a little bit of the first one, because TV does not rank very highly on things that I get to do on my daily life. But part of it is because I know nothing about soccer at all, but I do dearly love Ryan Reynolds. And so I was thinking about watching it just because I love Ryan Reynolds. And so
is this like a drama, or is it a drama, or?
No, he bought this team along with another guy.
I did hear about that. Okay.
They're putting it back together. And so I'm always curious with things like that, of how much is reality and how much is reality TV.
Mm-hmm.
Yeah, the number of people, on another note, that tell us to watch Ted Lasso is pretty
That's
amazing.
what I was just going to say. I'm like, I know nothing about this one, but Ted Lasso, that's what I think about.
Maybe that's kind of like watching medical dramas for us, and like, okay, we do this all the time. We don't need it. Thanks
never
very
watch
much.
medical dramas.
All right. So Susan, do we have questions for today?
We do. Let's do one question today. It says, hi, thank you for all you do. I know there's no right answer, but as someone who likes to balance optimism with realism so I can plan ahead, I want to know what point we should stop trying with IVF. I'm 36 with an AMH level of 0.01. Which I'm told is very low for my age. I'm otherwise healthy. My last round of IVF resulted in 2 follicles and 1 egg, which made it to fertilization, but did not develop after that. What my husband and I are now evaluating is the decision to spend money on 1 more round of IVF, a 3rd round, or pivoting our plan to adoption and possibly embryo adoption. Would love your perspective.
I have a much different perspective now because of Progyny that I did, like, say 2 years ago, because, in Nashville, we would have maybe people would go through maybe 1, maybe 2 cycles at the most. And after that, they just couldn't afford to do any more. And as we were talking about earlier, Progyny, particularly in Nashville, has just been tremendous in terms of offering patients, to do multiple cycles. And so I've seen people like this that normally I would have discouraged from ever even doing the first IVF cycle with a really low egg number. My gut feeling is, and now I've seen patients sometimes do way more than I kind of think they should. And I've seen them do, maybe just 1. I think that the sweet spot is at least 2, maybe 3. And I say that primarily because we have a huge population now that have Progyny coverage. So as we talked about before, I don't have to worry so much about talking to them about the cost. It's more the medical aspect of it and the psychological aspect, which is tremendous. It has made a huge difference for our practice in terms of the number of patients that we can see and the number of people that have access to care. So kind of my short answer would be, I would at least do it twice. If it were me personally, because maybe the stimulation can be altered a little bit. I mean, granted, your AMH is really low, but I think if you ask all 3 of us, we've seen that 1 in a million patient that we thought would never stimulate, never do very well. And we see it happen. And so for me, I would at least say 2, maybe if you have Progyny coverage, maybe 3, but probably not more than that.
I think this is kind of one of those where your heart and your brain meet, and you have to do what is the right thing for you and your partner. And when you look back at this 20 years from now, whether you're successful or not, and be like, yes, this was the right decision for us. And people make that decision based on lots of factors. And so, you've already been through 2 cycles. And so that third one, I mean, it is not only a lot financially if you're having to finance it. Going through IVF it's an emotional toil. I mean, there's so much writing on it, and it is stressful. But what you can get out of it can be absolutely amazing for the rest of your life. So I don't think that this is a right versus wrong answer. I think it's a where is your heart leading you answer. And if you decide, hey, getting pregnant with my own eggs isn't the most important thing for me at this point. It's more important for me to ideally have a positive outcome and have a baby, whether that is through conventional adoption or embryo adoption or donor egg or whatever you have, or even child-free living, that right answer is the one that is for the 2 of you.
So to back up just a little bit, because we have said Progyny, a half a dozen times already. And part of the reason why we asked Amanda to come on is because Progyny is such a different system than really anything else. It's very different from cash pay. It's very different from kind of a standard insurance system. And it's something that patients have a little bit more ability to advocate for with their own employers. And so, Amanda, can you give us the 2-line explanation of what is Progyny and why do we have you here today rather than just some random insurance person or somebody who's paying out of pocket?
Yeah, so, Progyny provides comprehensive fertility coverage that's really equitable across a population and gives people the opportunity to really focus on their care and not necessarily be thinking about the dollars and cents that are included within their fertility coverage. So everything that somebody would need from start to finish of a recommended treatment cycle will be provided to them in the fertility coverage that's offered through Progyny. We partner with self-insured employers, and then they provide it to their employees as a benefit. And we came to the market about 6 years ago, and came to the market because the way traditional medical carriers had been approaching fertility care was just really broken. They really approached it in that dollar cap maximum setup, and that was just not efficient for not only the patients, but also employers. They weren't getting good outcomes on both sides. And so Progyny came into existence to help improve outcomes for both patients and employers.
Can you explain kind of about what self-insured employers are. So
Sure.
our listeners who can kind of figure out, hey, is my employer a
Yeah.
self-insured employer?
Yeah. So it's something that a lot of people don't realize or don't know about their employer. So I would say that's very common to not know whether your employer is self-insured or not. I would say the majority of larger employers, so probably somewhere over 500 or over 1,000 employees, if you have that, it's likely that they're self-insured. And it's just basically the mechanism of which they pay for insurance. So essentially, they're assuming all the risk for their healthcare when they are self-insured. Other employers might be fully insured that are smaller because they can't basically manage or mitigate as much risk as a self-insured employer can. So I would say if you work for a larger company, it's likely you're self-insured, but it's an easy question that you can ask your HR team. And the majority of Progyny customers are self-insured. We do have a few fully insured customers today, and I think are expanding into that a little bit more, but I would say our primary book of business looks like self-insured employers.
So Susan and Abby, because both of your clinics use Progyny, how is it different for you when you have a patient coming in with Progyny versus traditional insurance or self-pay?
Do you want to take this first, Abby, or I can go?
Sure. I will say that it is in the state of Tennessee, and I've practiced now here for 20 years. It has made a tremendous difference. It has been, I'm trying to think of an equivalent, life altering, I guess, for patients and for physicians. We are so busy right now. We've done, I mean, it's just because all these patients can now get in and have Progyny coverage. We're seeing so many people from all walks of life that are now able to afford the care they really need. You know, I've had several patients that like realized all of a sudden that their employer carried it, and they like maybe had seen me 5 years ago and they couldn't afford to do IVF. They're like, well, we're at the end of the line. We can't afford to do IVF. So many people that have now been able to create families that never had the ability to do that. And the nice thing from a physician standpoint is, you know, you feel a little less bad if, say, a patient doesn't have a great outcome from their first IVF cycle, like say they only get just a few eggs or they don't have good fertilization, kind of like our, you know, what our question was about. You feel a little less bad because, you know, well, if they really want to do this again, they can do this again, and they don't have to plunk out $20,000 again to do this process. So it's been really fabulous overall, you know, for all of our patients and for physicians. We just feel like we can give more care now to more people from all walks of life that I've ever been able to do in my whole career. So it's great. It's fabulous.
So I would say that it has changed a little. I do counsel my Progyny patients sometimes a little bit more differently than I do my other patients. One, because not only, so in Texas, most people have diagnostic coverage. Most people don't have treatment coverage. So the diagnostic portion tends to be very similar. When we start talking about treatments, I generally don't talk insurance with my patients. I do talk insurance a little bit with my Progyny patients because Progyny patients are assigned a certain number of what's called smart cycles generally. And that helps them figure out how much treatment coverage they have. And I think the biggest change in my practice has been, I'm of course focusing on this pregnancy, but I have definitely started, even with my non-Progyny patients, just because I tend to do similar things, is I am now focusing on what a person or couple's family goal is, and not just saying, okay, you're 34 and you want to have a baby right now, and I need to focus on helping make that baby right now. Okay. Because most people out of pocket aren't going to be able to plan for those other children. They're going to just kind of deal with it when it comes. Whereas with my Progyny patients, especially, I can be like, what I tell my patients is, in your perfect world, not in the world where you're sitting here having a lovely conversation with me, how many children do you want to have? And if you're sitting there at 34, 35, and you tell me you want to have 3 or 4 children, how we use that Progyny benefit for your entire family building goal is going to be very different than if you come in and you're like, I want to have 1 kid and I'm done. because some people, that's all they want, and that's perfectly fine. But it helps us figure out what's going to be the best path, like I said, for their whole reproductive life, and not just focusing on this baby here and now.
Yeah, one of the things Susan and I just realized as we were talking, we've at our practice have probably had progeny patients for 3, maybe 4 years. I think we were one of the early ones that had progeny patients. And we used to have this thing called smart cycles, which I guess is still sort of the thing in Texas. You talk about pieces of pie, which is really a great way to talk to patients. Like, half a pie would cover, for example, an egg retrieval, and the other half would cover an embryo transfer. In Tennessee, up until about last year, actually it was until January, we were always thinking about pieces of pie, like how many pieces of pie have you used? How many do you have left? Now, I just realized in talking to Susan, basically we now in the state of Tennessee pretty much have unlimited cycles. So HCA employees can go through as many times as they need to until they create an embryo. Amazon employees, Tractor Supply, there's a whole list of them. And so now, honestly, patients can kind of go through whenever they want to, as many times as they want to in our patient population.
So, Amanda, going back to what we referenced at the very beginning of this, kind of all the progeny stuff aside, you have had quite the journey of fertility treatment and how do you build a family.
You've seen both sides of the story.
Yes.
And then some.
Yeah.
Like you have kind of hit all of the things that we do. And so what, for our listeners, please tell us what you have been through and how and where you are today.
Yeah, I try to do this in like a condensed version as much as I can, but there's like little details that I always want to share. So if there's something you want me to expand upon, let me know. So we started trying to build our family in 2013. And when we started that process, I was 27. So I was really young, but my FSH was high for my age, but I didn't have any coverage at the time. And so when you're 27 years old, like knowing you have to go through IVF seems unattainable, right? Like I did not have savings available to tap into. And I think a lot of people face this like first medical crisis that you don't expect yourself to be in, right? And I was a college athlete. My husband was a college athlete. Like I thought this never could be our situation. And so we tried IUI a few times. That was not successful. And then we decided, because we needed to move forward with IVF, that we would find kind of a lower cost treatment option of a clinic. And I think because we were facing kind of so much cash pressure at the time, we had to make that decision. And, looking back now at everything that I know, I probably never would have done that, right? But that's where I was at the time. And I think a lot of fertility patients tend to be in that kind of place. And then, that cycle didn't work. That was the first IVF cycle that we did. We continued, we moved a few times and then found a new reproductive endocrinologist. We did 3 more rounds of IVF. And I ended up having kind of a diminished ovarian reserve diagnosis. So we had to do a lot of rounds because I wasn't getting a lot of embryos from each cycle. I would maybe get one, transfer one, it wouldn't work. And so we did 4 cycles of IVF, all cash pay.
Wow.
And that was really taxing. I did that from, I think, 27 to 30. And when we did that, once we got to our 4th round and that didn't work, I was in a pretty dark place with it. And so we actually shifted gears and we looked to do donor eggs at that point. My sister actually decided to donate her eggs to us, which is an amazing process. And she's older than me and produced way more eggs than I did. And we went through that whole process. And we actually got a grant to go through that process because we were completely like out of cash at that point. And that didn't work. And so we were like completely lost at that point. We shifted to find out I had endometriosis, had surgery for endometriosis, was diagnosed with stage 3 endometriosis after that, had that removed up with a provider in New York City. And then after that, we ended up actually looking to do a surrogate. So we had the embryo created from my egg and my husband's sperm, hired or found somebody to be a surrogate. That ended up failing again.
Wow.
Too many Christmas.
Yeah. And then I
can tell you're a college athlete because you never give up. You just keep going and going and going.
Well, but it's crazy. It seems
Resilience.
crazy at the time. And like going back to that person's question that they asked, I think it's so personal to you, like what is going to work for you. And I had this burning kind of like desire inside of me that wouldn't stop. And not everybody feels that or feels like you can continue with that.
Yeah.
And that's okay. Like that is perfectly fine if you're that patient. It just wasn't for me. So for me, I felt like I needed to keep going, and I tried to kind of like exhaust every which way. Once we went through that kind of failed surrogacy journey, we found a different reproductive endocrinologist in Dr. Peter Klatsky at Spring Fertility in San Francisco, California. And I was guided to him through some resources at Progyny because of my specific case and kind of what he focuses on. And I went through 3 retrievals in California, and we were able to create beautiful embryos from that process. I still didn't get a lot of eggs, but they turned into beautiful embryos. And in 2020, January of 2020, we transferred an embryo, and my daughter was born in September of 2020. And so 9 rounds of IVF, but she finally.
Now, the latter half of your fertility journey was with coverage and not self-pay at that point.
Correct. So after I think it was after that donor where we got the grant, I actually had moved on and started working at Progyny after that. And so I was able to go through 6, 7, 8, 9, those rounds of treatment with Progyny coverage. So I was able to really see what the difference is of when you are cash and the decisions you have to make and some sacrifices that you almost have to make versus when you have coverage.
So I'm just curious, emotionally, when you had coverage for fertility treatment versus when you didn't, I mean, I know you still obviously had anxiety and stress because you were worried about the outcome, but I do find that people are a little bit more kind of relaxed and a little bit more laid back because they don't feel like, oh my gosh, if this doesn't work, I can't afford to do another cycle. Is that kind of the experience you had as well? Or?
Yes, absolutely. And like, I always think about this, I have this screenshot on my phone, and this screenshot on my phone is a picture of, like when you get your Amex or your credit card statements and it comes up on your phone and it shows how much you charge at Starbucks or wherever. And it was my fertility clinic, and it said $16,000, 500. And I took a screenshot because I was like, when in my life have I ever seen that, right?
Oh,
like you're normally looking at a Starbucks charge. And so you go from that situation to not seeing that really at all. And that is a huge game changer, to feel like you can continue and feel like you can pursue what you want to achieve. And like my daughter would not be here without Progyny coverage. Absolutely. Yeah. And of course, some fortitude on my part too, but like she would not be here because we couldn't have continued to keep going. And that part to me is so wild to think about, is that the insurance has that much influence on people's outcomes,
So if you happen to work for a company that is self-insured and has Progyny, that's great. But what would you say to our listeners who don't work for a company like that? What words of advice do you have for them?
Yeah. So I think that one of the most powerful things that people have in this case is your voice that you can use. And on a daily basis, my job is to speak with benefits leaders or HR teams about Progyny and why they should include fertility coverage in their benefits package. And 65% of employers that added fertility coverage added it because somebody asked for it. So that is very powerful, and it's scary, right? Like it is scary to say to your employer, I'm trying to get pregnant and I'm struggling, right? Like that's a scary proposition. And
Like people
I
don't
get
even
it.
share it with their family and friends, much
Right.
less their boss.
Yes. So there are some resources that we have, as well as Resolve also has some really great resources that help people navigate that path, whether they want to do it anonymously or they want to do it with their own voice. But regardless, your voice matters, whether you actually use your name or you use, are anonymous in asking for it.
I have 2 patients that successfully negotiated to have their employer use Progyny, because I usually tell patients if they say, oh, I don't have coverage, or they work for a big company, I'm like, well, here, let me write it down. Progyny. Go tell them that you want Progyny coverage, because I tell them it's not the Cadillac coverage, it's the Bentley coverage in Nashville for fertility. It's amazing. And I'd be interested to hear from your standpoint, Amanda. I have a lot of patients who really brag about how helpful Progyny is for them, and Progyny will reach out to them and remind them about appointments. And can you speak to that a little bit? Because I don't really understand exactly what Progyny does, but the patients really love working with your providers for sure.
Yeah. So one of kind of the foundational elements of Progyny is that every patient has access to what's called a patient care advocate. And so that's a real human being that works at Progyny, and they are assigned to every individual who calls in to Progyny to learn more about the benefit. And you're assigned one person. So you actually have their name, their phone number, their email.
It's not the random person you get.
No.
Yeah, like you think about the last time you talked to an insurance company, obviously you don't remember that person's name you talked to, right? And Progyny looks very different. People build relationships with their patient care advocates because you're sharing something so intimate with them about building your family. And so on average, our patients talk to their patient care advocate about 15 times in their journey. And so it's really there for education. So to help them maybe understand their clinical condition, if they didn't write down everything at their doctor's appointment, it's helping them understand, their appointments that are upcoming, what they can expect from their medication that they have. So really somebody to hold your hand throughout the process. And it makes a world of a difference also emotionally to have somebody to support you that actually knows what's going on, right? So that is a huge component of the benefit. And it's really fun. We get to see what people say about their patient care advocates. Like you write reviews, and always there's glowing, and people say such nice things about our patient care advocate team. They are incredible. And a lot of them are former fertility nurses or worked in a clinic setting. So they have a background of working with fertility patients.
It's been funny a couple of different times. I'll tell a patient when I see him now, remember, you've got to do . Oh yeah, my patient advocate already reminded me about that. I'm like, oh, great. So they really are really helpful for physicians too. We really appreciate that extra support for patients. It really helps a lot.
So Amanda, I am curious as to when you were doing the first half of this epic journey here, what were the things that you cut back on versus the things that later on you were like, yes, I can do this. Yes, I can add this. And, aside from the whole cycle itself, which is huge, but what were the more nuanced things that you were like, no, I just can't do this because I can't afford it? Or later on, yeah, I can do this because it's the right thing to do. And I just couldn't do it up until now.
I'm going to add in, can you also comment a little bit about like your first cycle? You said you did a lesser cost IVF and what that really means in the real world.
Yes, absolutely. I can say that. So I think, when you're making decisions based on finances, you're not making decisions necessarily based on quality, right? Because you're solely focused on these dollars and cents and not necessarily focused on the outcome. And I think that's the biggest difference in the journey. And so some examples for me personally that I saw is number one, the first is choosing a lower cost clinic that maybe didn't have the outcomes that were good because the cost was more efficient for me at the time. So I think that I navigated to that more quickly because I was so worried about dollars and cents. And so I think, my recommendation to people navigating this now is to really look at SART data and understand what are the outcomes of the providers that I'm going to see, and make sure it's the right match for you before you move forward with treatment. Because once you're there, like you're moving forward with that practice, right? And so you're able to you should ask more questions up front before you kind of commit to a practice.
So just to add in, SART data is the Society for Assisted Reproductive Technologies, and you can actually go on the CDC website and look up success rates for different clinics, correct?
Yeah, exactly. And so, for a progeny patient, they have access to obviously a network of providers that Progyny's already curated and looked at outcomes, figured out which providers are the ones that are optimal to potentially work with. So we've kind of done that heavy lifting so patients don't have to think about that.
I'd like to say that's really nice because quite honestly, it's hard for reproductive endocrinologists to understand SART data, much less people who this is not what they do every day. So when we say, oh, go just check out SART data and see which one you think is the best, like that honestly is a pretty big ask.
I mean, anybody could actually go to Progyny's website too and look at our network. Like anybody, you don't have to have access to Progyny to do that. So that would be a nice, safe kind of bet to help somebody too.
There's a lot of nuances in all of that data, both SART and CDC, that even when you think, oh, this is obviously the better one, it's really not, for a multitude of reasons that an average person just isn't going to know. And it's even hard for us who do know, wait a minute, there's a bias there. This is not right. This is not really accurate.
Yeah. If you want to see a really hot conversation, put 100 REIs in a room and be like, let's discuss how SART data works.
So if I shift back to the question on kind of some, sacrifices that I made in my treatment, some other examples would be, it was a different time, but I did transfer multiple embryos in my early IVF cycles. It was a few years ago. So, data might be different today and, what somebody would recommend for me. But I did do that because I didn't want to pay for another transfer, right? And I was pressured or cost pressured to make that decision. Now, providers today might not do that as much, but I think that I influenced because I said, I don't want to pay for a transfer again, right? And I didn't think about what would it be like to have twins, or what are the risks to me? I didn't.
Or triplets.
Exactly. I did not think through that process clearly. And then I definitely did not do PGT or PGTA. I did not do PGTA during my early IVF cycles because I didn't want to pay another $3,000 for an out-of-pocket test when one of those early cycles ended in miscarriage. And it was from an abnormal embryo, most likely. And so when I look back on that decision, I wonder, was all of that worth it to sacrifice not getting that test?
Hindsight.
But we see that all the time, even in patients today that don't have progeny. That's exactly the kind of changes or the decisions patients make. And, it decreases their pregnancy rate by about 15% if they don't pick a genetically normal embryo, because we just don't know the genetics of the embryo that we transfer. So
for me, I would say those are kind of some examples. And I think for any patient that's going through this process, my advice is to just really step back and think about every kind of component of the decision-making process and how it will influence your outcome. Even if you're paying cash, make that calculation, write down, if I pay $3,000, then it's going to cost more upfront, but maybe I, prevent myself from going through an emotionally really difficult miscarriage and process that comes along with that. And think through these decisions, because I don't think I did, because I was so focused on cost in the beginning. And so as I progressed to having coverage, I was just able to make decisions more clearly that were really focused on getting me to that healthy outcome.
Did you hear your physicians differently at different stages in the process? When you think about the things you remember from cycle number 1, cycle number 5, and cycle number 9.
You had a number of different physicians through this process.
I did. I did. Yeah, absolutely. I think you hear differently. I think in the beginning, I was definitely less educated on the process of fertility treatment. And so everything seemed big and scary that I was going through and overwhelming. Whereas towards the end, I was very well educated on the process and knew the ins and outs of every every piece of guidance that I was getting. And I almost at the end could like say, well, why are we doing this? What is the reason?
Why'd you use that dose of FSH this time?
Exactly.
So when you say, I mean, obviously people who are listening to this podcast are already self-educating themselves to a certain degree. And a lot of the reason we started this podcast is because Dr. Google is like the bane of our existence.
He went to a questionable
we
medical
spend
school.
more time talking
We don't
people
like
off the
Dr.
Dr.
Google.
Google ledge than we do
Yes.
teaching about all the things we could teach. How would you recommend listeners educate themselves about their fertility treatment process? What are some good avenues to look at, and what would you recommend them not do?
Yeah. Oh, this is a hard one. So I think remember that your journey is unique to you. So my journey is not the same as person that I see on Instagram that has an IVF journey. And I think a lot of times patients try to like assign themselves to another human being and say like, oh, I look exactly like that. And I kind of wish I wouldn't have done that as much in the beginning. And just realize like my journey is unique. And yes, you can learn bits and pieces from other people, but not try to like mirror exactly what somebody else has, because you just have no idea. It's almost like, you know, that all has filters on it and you can't see through all the details. So I think there's, you know, there are some resources that are available on YouTube that are actually by fertility doctors that I think are really helpful. So I know that a lot of fertility providers and practices have YouTube channels that actually have really amazing educational information. Progyny also does. And then like your podcast is a great example of somebody being able to educate on all different topics and pick ones to their likings. So I would say like using bits and pieces of information from different places is really important, but making sure that you remember that your journey is uniquely yours. And I don't think that anybody's journey looks exactly the same. It may sound like it, but everybody's kind of path is a teeny bit different.
Thank you so much. We are so appreciative of both your expertise and your willingness to share what had to have been really a wild journey over those 9 years.
Long journey.
Yeah.
And as one final note of hope, what are you planning on doing in your family building for the future?
Yes. I cannot believe that I'm able to say this, but I am 22 weeks pregnant. And due in March with a little baby that, you know, like I'm thinking about that question that Susan, you asked about like, what do you want your family to look like? And I never thought that, I don't know if I could ever see this for myself. And that is absolutely incredible. And like, I know what people are going through that are listening to this podcast. Like, I get it. It is gut wrenching and awful and scary. There's so many words that can't even like encompass what you feel right now. And like, it's almost sometimes a little bit annoying that I'm sharing that I'm pregnant on this podcast, but I also believe
but that's great. That's hopeful.
It is hopeful, right? It is hopeful that there are circumstances that you can get through to the end of this journey. And like, I, you know, was carving a pumpkin with my 2-year-old daughter today. And like, I still think about what I went through to get her, you know, and I'm just so grateful for this science, this field, everything that everybody is doing to make these outcomes happen for people, because it's absolutely incredible.
That's awesome.
That's awesome.
Congratulations.
Yeah. Thank you.
I hope all goes super smoothly. And
yes,
thank you for sharing so much of yourself in going through this. And of course, to our audience, you know, thank you so much for listening. Be sure to tune in next week for more. Be sure to subscribe, leave us a review in Apple Podcasts. We would love to hear from you. We're on Instagram, we're on Facebook. We also have a YouTube channel. So hop on by, leave us a like, leave us a follow, say hello, tell us all the things.
And you can also visit us on fertilitydocsundcensored.com to submit specific questions. All questions will be answered on the podcast for our Ask the Doc segment. We'd love to hear episode ideas. So let us know what you're thinking. We love to hear from you.
As always, this podcast is intended for entertainment and is not a substitute for medical advice from your own physician. All right. We'll talk to you soon.
Bye.
Bye-bye.
Bye.